Hi, this is Jessica DaMassa with WTF Health. I'm here at Webit in Sofia, Bulgaria, and joining me right now I have Szabi. He is with a company called Turbine that is doing some really cool stuff creating digital cells. So tell me a little bit about what you guys are doing.
That's actually a pretty good approximation. So we have found a way to take most of the biological knowledge we as a species have about how human cells work and turn that into a digital copy of a cell, basically. And we can tune this cell to behave like any type of cell. Mostly we focus on cancerous cells now, so we can make it behave like, for example, a specific patient's tumor. And then what we can do is obviously we can test how, for example, certain drugs or combinations of drugs would impact this cell and how ultimately they would benefit a patient.
Okay, so this is completely digital. It's not like you're creating like a biological copy or anything like that. And so what are you able to do? Like what kinds of things are you able to test?
What we have already shown is that we can delineate between, let's say, aggressively dividing cells and dying cells. So typically what we do in most of our work with, for example, Big Pharma, is predicting what type of interventions and what type of drugs would actually push certain patients or certain types of cells into apoptosis, which is programmed cell death, which then started out in a proliferative, aggressively dividing manner.
Okay, and now you're using this right now on the innovation side with drug discovery, right? And so talk to me about how you're helping, I guess, shorten the time it takes for a pharmaceutical company to get some really valuable input on how their drugs are going to be impacting somebody's cells.
Yeah, so first up, what we obviously can do, since all of this is computational, we can run practically an experiment that they would run in the lab for days or weeks or months. We can run it at the constant speeds of compute. So first up, what we're doing is we help them, let's say, screen a much larger search space, much more, test much more, really, and get a much better understanding of how their drugs work. This is the first thing. So then what that helps them do is run much better research activities, have a higher chance of success, and really create a better trial protocol. And ultimately, our goal is actually showing that we are predictive of how patients themselves respond in trials and obviously outside in the clinic. And so when we've shown that, we'll be able to basically say that in our predictions or with our predictions, you can really ensure that your trials succeed and that your drug gets to approval and patients much faster.
I mean, right now they're saying, I think the number is 17 years, right, that it takes for something to go through. So how quickly are you able to expedite this process for them?
Well, if you look into, let's say, really successful drug development projects versus less successful drug development projects, you can see that there can be a difference of even let's say, double the time it takes to get a less successful and less well-developed drug to market versus a really well-designed trial strategy. So that's sort of the, let's say, the slack that you can cut out of the process, which can be, 5 to 6 years even in some development cases.
Okay. And how are you able to use this technology, or like, I guess in the future, is this something that can be put into like a precision medicine kind of initiative? Like, are you able to if you can recreate my cells digitally, right, or your cells or somebody else's cells, so you're able to would you be able to tell how a certain drug will impact each particular patient?
Yeah, that is the ultimate goal, really. We already have research collaborations with some academic institutions, where what we're doing is actually creating digital copies of the patient's tumors themselves and testing drugs and drug combinations on that for actually personalized therapy. So that is, let's say, the ultimate goal of the technology. Obviously, it takes a lot of time to really show that we can ethically help drive those decisions.
I'm also curious, are you any plans to go outside of oncology? Any plans to go outside of cancer?
Sure. I mean, the model itself that we're building is a general model of human cells. We're just focusing on oncology, and that's where we have most of the validation. Our goal is actually expanding our model with novel biological mechanisms that are relevant outside of oncology as well. So first up, we're actually focusing on immunology. We're building models of immune cells now, and we're predicting how they would impact tumors, but obviously that leads to immunological diseases and other more complex diseases.
Okay, so talk to me about your business, because this is just fascinating to me. I mean, the technology is incredible. So where is Turbine at? Are you guys raising money? You're based in Hungary.
Yeah.
So talk to me, what's going on?
We've built a team of 30 over the past year, really. Started out with 5 people at the end of 2016, and now we have 32. Most of that is biologists, data scientists, and AI specialists. And what we're actually getting ready to do now is raising our A round. The reason we're doing that is that we feel that now we have a good grasp on what are the problems that we need to solve. We have a good grasp of where we want to take the technology itself. and we just need basically, resources to sort of power through that. And we started the process a couple of weeks ago, and I really hope that we'll finish it in a couple more weeks, and then we'll get back to building the company.
All right, and all of you are based in Hungary?
Yeah, the entire team is in Hungary currently. We are planning to move abroad, obviously.
Very good. Well, we'll look forward to seeing what happens with you guys. Thank you so much for joining us and for sharing what your business is all about. It's just remarkable to me that you're able to do all of this. How exciting.
Thank you for
Very
talking.
good. No problem. Thank you. This is Jessica DaMassa with WTF Health here at Webit. Thanks so much for joining us.